What is hepatitis B? Hepatitis B is a severe liver infection caused by the hepatitis B virus, HBV. Hepatitis B is typically a short-term infection, also known as acute, that lasts less than 6 months. However, for others, the infection becomes chronic, which means it lasts longer than 6 months. Chronic hepatitis B increases the risk of developing liver failure, liver cancer, or cirrhosis, a condition that permanently scars the liver. Most adults with hepatitis B recover completely, even if their symptoms are severe. Infants and children are more likely to develop a chronic hepatitis B infection. This is referred to as a chronic infection. Hepatitis B can be prevented with a vaccine, but there is no cure if you already have it. If you're infected, taking certain precautions can help you avoid spreading the virus to others. What are the symptoms of hepatitis B? The symptoms of acute hepatitis B range from mild to severe. They typically appear between 1 and 4 months after infection, though they can appear as early as 2 weeks. Some people, particularly young children, may not exhibit any symptoms. Hepatitis B symptoms may include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of the skin and the whites of the eyes, jaundice. What are the causes for hepatitis B infection? Hepatitis B is caused by the hepatitis B virus. The virus spreads from person to person via blood, sperm, or other bodily fluids. It does not spread through sneezing or coughing. How does hepatitis B infection spreads? Sexual contact. You may contract hepatitis B if you have unprotected sex with someone who is infected. If the person's blood, saliva, sperm, or vaginal secretions come into contact with your body, the virus can infect you. Sharing of needles. HBV is easily transmitted through contaminated needles and syringes. Sharing 4 drug supplies puts you at high risk for hepatitis B. Accidental needle sticks. Hepatitis B is a risk to healthcare workers and anyone else who comes into contact with human blood. Mother to child. Pregnant women infected with HBV can transmit the virus to their babies during childbirth. In almost all cases, the newborn can be vaccinated against infection. If you are pregnant or plan to become pregnant, talk to your provider about getting tested for hepatitis B. Acute versus chronic hepatitis B. Hepatitis B infection can be short-lived, termed as acute. Alternatively, it could last a longer time, which is known as chronic. Acute hepatitis B infection lasts for less than 6 months. Your immune system is likely capable of clearing acute hepatitis B from your body, and you should fully recover within a few months. Most people who contract hepatitis B as adults develop an acute infection, but it can progress to a chronic infection. Chronic hepatitis B infection lasts 6 months or more. It lingers because your immune system is unable to fight off the infection. Chronic hepatitis B infection can last a lifetime, potentially leading to serious conditions like cirrhosis and liver cancer. Some people with chronic hepatitis B may experience no symptoms at all. Some may experience persistent fatigue and mild symptoms of acute hepatitis. Risk factors of hepatitis B. Hepatitis B spreads through contact with an infected person's blood, sperm, or other bodily fluids. Your risk of hepatitis B infection rises if have unprotected sex with multiple sex partners or someone infected with HBV. Share needles during 4 drug use. Are you a man who has sex with other men? Live with someone with a chronic HBV infection. Are an infant born to an infected mother? Get a job that exposes you to human blood. Travel to areas with high HBV infection rates, such as Asia, the Pacific Islands, Africa, and Eastern Europe. How hepatitis B is prevented. The hepatitis B vaccine is typically administered in 2 doses separated by a month, or in 3 or 4 doses over 6 months, depending on the vaccine. The vaccine does not cause hepatitis B infection. Hepatitis B vaccine is recommended for adults aged 19 to 59 who have no contraindications. The hepatitis B vaccine is also highly recommended for newborns, children and adolescents not immunized at birth, those who work or live in a center for people with developmental disabilities, people living with someone who has hepatitis B, healthcare workers, emergency personnel, and other individuals who come into contact with blood. Individuals who use illegal drugs or share needles and syringes. Patients with chronic liver disease. Patients with end-stage kidney disease. Travelers planning to travel to an area of the world with a high hepatitis B infection rate. When to visit a doctor. If you are aware that you have been exposed to hepatitis B, contact your doctor right away. If you receive preventive treatment within 24 hours of being exposed to the virus, you may be less likely to become infected. If you suspect you have hepatitis B, talk to your doctor. Disclaimer. This video contains general information and discussions on health and related topics. The information and other content in the video, as well as the linked materials, are not intended to be used as a substitute for medical advice, diagnosis, or treatment. Please consult your doctor before beginning a new medication or health regimen.